Selecting the bariatric surgeon to perform your weight loss surgery is often as difficult as selecting which type of treatment to have. The type of minimally invasive surgeries performed at the New York Bariatric Group are more technically challenging, and when contemplating a surgery such as this, patients need to seek out only very experienced bariatric surgeons who perform this type of surgery day in and day out, successfully with very low complication rates. I would like to tell you about my background and introduce you to my colleagues and associates here at the New York Bariatric Group, who will in turn tell you about their background, our surgically based long-term weight loss program, and about our special commitment to compassionate care for each individual patient's needs that have been the hallmark of our successful treatment program. I began my medical training at the New York Medical College and graduated in 1992 in the top 10% of my class. I then went on to complete my general surgery training at Long Island Jewish Medical Center. After completing my general surgery training, I went on to complete an advanced laparoscopic fellowship at the George Washington University Medical Center in Washington, D.C., training under the world-famous laparoscopic surgeon, Dr. Jonathan Sakier. I then spent some time specializing in laparoscopic bariatric surgery by training with Dr. Alan Whitgrove, the surgeon who performed gastric bypass surgery on singer Carney Wilson. Subsequently, I returned to my hometown of Long Island to start the New York Bariatric Group. I've been performing bariatric surgery since 1998 and have dedicated my practice to the care of bariatric surgery patients. My experience includes performing over 3,000 laparoscopic gastric bypass procedures, over 3,500 lap band procedures, over 800 sleeve gastrectomies, and over 200 endoscopic revision procedures, and over 1,000 bariatric revisional procedures. Staying up to date on all of the newest technologies for weight loss, I was the first surgeon to perform laparoscopic gastric bypass on Long Island, the first surgeon to perform stoma-fix revision surgery in the tri-state area, the first surgeon to perform Rose procedure on Long Island, the first surgeon to perform virtually scarless single incision lap band and sleeve gastrectomy on Long Island. I have the largest experience with laparoscopic weight loss surgery in all the area.
Dr. Garber is a fellow of the American College of Surgeons, a fellow of the American Society of Metabolic and Bariatric Surgeons, and assistant clinical professor of surgery at the Albert Einstein College of Medicine. He was nominated by Castle Connolly as one of New York's top bariatric surgeons, and the only bariatric surgeon on Long Island nominated by New York Magazine as one of New York's top doctors. Only bariatric surgeon on Long Island nominated by New York Magazine as one of New York's top minimally invasive surgeons. Dr. Garber is the only bariatric surgeon nominated by Newsday as one of Long Island's top doctors. And he is on the medical advisory board of Obesity Help and chief medical editor of Bariatrics Today magazine. Dr. Garber has been featured on the Dr. Oz Show, Montel Williams Show with Carney Wilson, Living It Up with Allie and Jack, Discovery Health Channel, ABC, CBS, and NY55.
Perhaps the accomplishment that I am most pleased to have obtained is the one bestowed by Healthgrades, the distinguished independent organization that evaluates physicians and hospitals throughout the United States. Our program was rated #1 in New York State and among the top 5% of bariatric surgery programs in the U.S. with the lowest complication rates in the state. I am currently the chief of bariatric surgery for the entire Catholic health system, as well as the chief of bariatric surgery at Mercy Medical Center, St. Francis Hospital, and Hudson Valley Hospital. Patients who participate in our surgical-based long-term weight loss program can lose anywhere from 70 to 80% of their excess weight and keep it off long-term. We have been designated a Center of Excellence by the American Society for Metabolic and Bariatric Surgery. Our outcomes are tracked, and we are required to submit detailed records of each of our cases. You can see some of our patients' results for yourself here on our website and listen to a number of our patients share their own experiences about how things were done and their outcomes.